headlines, the arguing pundits, the red alerts, it's hard to ignore how gun violence has become an all-American news staple. So is it time we stop treating gun violence as a front for an ideological war and start treating it like a public health issue? If that sounds crazy, just look at cars. We do a lot for car-related violence as a public health issue that we don't for gun violence. For instance, yes, we've got a lot of statistics on gun violence, but what we don't have is a national database with information on every single gun death in the country. We do, however, for every car death. Whenever someone is killed in a car accident, everything from the speed of the car to details about the tires to the make of the car are entered into a national database. That database heavily informs what car safety standards and policies will look like. The sort of policies that have reduced the deaths per mile by more than 90%. We're talking speed limits, seat belts, safety glass, airbags, child seats, even highway dividers. But we don't have that devotion to gun deaths, and that's thanks in large part to the powerful lobbying of the NRA. In 1996, Congress passed an amendment that banned the Centers for Disease Control and Prevention from funding any sort of research that would advocate or promote gun control. And in April 2016, over 100 medical and public health groups issued a letter calling for increased federal funding of research into gun violence. The letter referred to gun violence as an epidemic. And if the opinions of those in the medical and public health fields don't convince you, well, the stats on gun violence are compelling. While gun homicides and violent crime overall have gone down, the leading cause of premature death in the United States is gun-related, surpassing car deaths. Making gun violence a public health concern doesn't mean we're arguing about whether guns are constitutional or not. The Second Amendment isn't going anywhere. But looking at gun violence through the lens of public health means it becomes possible to 1. Push for funding for research into gun-related deaths, and 2. Create policies for gun safety that reduce death and injury. And that can work. In promoting car safety, no cars were banned. Conditions were put in place that make driving a car safer. And for public health groups, it's the same for guns. They don't want to ban them, they want to control the factors that make gun violence as deadly as it is. Factors like background checks, gun seller licensing, funding for mental health, and funding for research on gun violence itself. So, can treating gun violence as a public health concern bring together people on both sides of the gun control debate?